Hi, my name is Marcy Bridges, and I'm a social worker, and I also have my MHRTC certification. I work at a state-run psychiatric hospital in Bangor, Maine. It's called Dorthea Dix Psychiatric Center. At Dorthea Dix, I work in the outpatient department primarily as the social worker there. I also get to work with inpatients, individuals that are not criminally responsible for their legal charges, and I also get to work with people that have intellectual or developmental disabilities. I think the helping field chose me. I didn't really choose it. I always wanted to be a psychiatric nurse, but life led me in different directions, and so I now get to work as a psychiatric social worker. I started off my career, I went to nursing school for a year after high school, and life led me in different directions. So I had worked as a CNA, which is a course that I took when I was in high school because I knew I wanted to be a nurse. After I had to take some time off from college, I went back to school. I started off in an MHRT program, which satisfied the classes that I needed to put toward my associate degree in human services. And then I went on to get my bachelor's degree in mental health and human services. And when I graduated, that gave me the credentials for my MHRTC. Along the way, I made sure that I used every elective that I needed to put towards some type of certification or a certificate. So I hold a certificate in working with youth and children, and I also hold a certificate in working with individuals that have experienced sexual abuse. I love several different things about my job. I love getting to work with individuals and seeing them grow and have success in their lives and to maintain recovery and stability for long periods. I also love that I get to work in part of a greater system. I get to advocate for change, and I also get to work with many different types of professionals, from occupational therapists, psychiatrists, medical providers, recreation therapists, so it's very rewarding. We work with a big team at the hospital, so I get to learn a lot and always grow. I think the biggest challenge in being a social worker is time management, managing the face-to-face time that I need to put in with my clients, and also having enough time to be in my office, making phone calls, and doing the documentation to prove that we're doing the work that we're supposed to be doing. So that can be very challenging to manage your time efficiently. And just remember that you're only one person, you can't do everything, so prioritizing what needs to be done today and what can I leave for tomorrow. One of the most rewarding experiences that I've had, I worked with an individual that had a developmental disability, very hard to place, was stuck in the state hospital, not able to find appropriate housing and services for this person, who was also stuck in the mental health system when they really needed to be in the adult developmental system. So in advocating for this individual, our hospital actually brought on board board-certified behavior analysts to help with the function of behavior. And as a result, some statewide teams, instead of working opposite each other or beside each other, we collaborated. And this individual discharged to an appropriate setting with the appropriate services in the appropriate system for developmental services. And that really set the pathway. We've since then collaborated with SAMS, which is Substance Abuse and Mental Health Services, OADS, which is the Office of Aging and Disability Services. We've worked with staff at the Commissioner's Office, Office of Maine Care Services, Crisis Services, and we've worked with 2 other individuals working to get them appropriately placed. So in the process of helping that one individual, there's systems change that are actually happening right now, which is very exciting. My advice for individuals that want to work in the field of behavior health is to just be brave and jump in and do it. There are so many different disciplines that work within the field of behavior health that you'll really have a good opportunity to see what you might like, what you might not like, and what your strengths are, and that can really drive the direction that you go in. I had started off years ago working as a BHP, and now I work in a state hospital as a social worker. And I'm grateful for all of the experience that I had, whether it was working as an ed tech, working with individuals with autism, or working one-on-one in people's homes, working with individuals with challenging behavior.